How safe do you believe vaping to be? This question has been at the epicenter of countless debates as the world grapples with the rise of e-cigarettes and vaping devices. For many, the allure of vaping lies in its purported safety, a beacon of hope in the fog of traditional smoking. Yet beneath this veneer of safety, a complex issue lurks, one that we are only beginning to comprehend. E-cigarettes have quickly gained popularity, their sleek designs and enticing flavors seducing millions around the globe. A walk down any city street, a glance in any high school hallway, and you're likely to spot the unmistakable plume of an e-cigarette. This booming popularity is no accident. It's the result of a carefully orchestrated marketing strategy. Vaping companies have positioned their products as the healthier alternative to traditional smoking, a claim that's not wholly unfounded. After all, e-cigarettes don't produce tar or carbon monoxide, two of the most harmful substances in traditional cigarette smoke. This fact alone has been enough to convince many that vaping is a safer choice. But is it really? Despite the absence of tar and carbon monoxide, e-cigarettes are far from harmless. They deliver a potent dose of nicotine, a highly addictive substance with a multitude of health risks. In fact, recent studies suggest that vaping may increase the risk of heart failure, among other serious health conditions. Moreover, the safety of the other chemicals found in e-cigarettes is still largely unknown. Propylene glycol, vegetable glycerin, and a myriad of flavoring agents. These substances are generally recognized as safe for oral consumption, but their effects when inhaled are still shrouded in mystery. While it's true that vaping may be less harmful than traditional smoking, it's a far cry from being safe. The illusion of safety, propagated by vaping companies and reinforced by our own wishful thinking, obscures a harsh reality. In truth, the safety of vaping is a complex issue with many aspects yet to be fully understood. As we peel back the layers of this illusion, we're confronted with a sobering truth. Vaping is not the harmless alternative it's often made out to be. What if the safety of vaping is a mere illusion? This question hangs in the air as we delve into the mounting evidence that suggests vaping isn't as harmless as some might think. Recent studies and research bring to light a myriad of potential health complications linked to the use of e-cigarettes. One such study, which tracked 175,000 adults in the United States, found a shocking correlation between vaping and the onset of heart failure. It revealed that those who vaped were nearly a fifth more likely to develop this deadly condition compared to those who refrained from using these devices. The stark reality of this finding underlines the potential danger lurking in the innocuous-looking clouds of vape smoke. But heart failure is just the tip of the iceberg. The list of reported adverse side effects related to vaping is extensive and continues to grow. From headaches to strokes, the number of reported side effects has now surpassed a staggering 1,000 in the United Kingdom alone. The surge in these reports is a chilling testament to the potential harm vaping can inflict on the human body. Each report adds another piece to the puzzle, revealing a picture of harm that is far removed from the safe alternative to smoking that e-cigarettes are often marketed as. The truth that emerges from these studies and reports is sobering. Each new piece of evidence chips away at the illusion of safety surrounding e-cigarettes. The nicotine-laden vapors, once thought to be a safer alternative to traditional smoking, are increasingly being linked to a wide range of health problems. The narrative of vaping as a harmless habit is being challenged by the stark reality of scientific research. The once glossy image of vaping is starting to tarnish, replaced by a much grimmer picture of potential health risks and complications. As we continue to uncover the truth about vaping, one thing becomes abundantly clear. The supposed safety of vaping is far from a certainty. The evidence is mounting against the supposed safety of vaping. How does the vaping epidemic impact our younger generations? As we delve into the heart of the matter, we find ourselves confronted with a chilling reality. The vaping trend has infiltrated our schools, our parks, and our homes. It's not just adults puffing on these nicotine-laden devices. Alarmingly, our children and teenagers are being swept up in this wave, with 1 in 5 kids having tried vaping. In just 3 years, the number of young vapers has tripled, painting a concerning picture of the future. These are not merely numbers on a page. Each statistic represents a young life, a developing brain, a vulnerable body exposed to the potential harm of nicotine and other harmful substances found in vapes. Nicotine, the addictive substance in vapes, can harm the developing adolescent brain, particularly the parts that control attention, learning, mood, and impulse control. Long-term effects on respiratory and cardiovascular health are also a significant concern, especially given the recent findings linking vaping to heart failure. In the face of this escalating crisis, it's crucial to understand the legal landscape. It's illegal to sell vapes to those under the age of 18. Yet these laws are often flouted, with the devices finding their way into young hands. This is where the enforcement of regulations and penalties comes into play. There's an urgent need for more stringent measures to prevent the illegal sale of these devices to minors, and greater fines for those who ignore these rules. But legal measures alone are not enough. Education plays a pivotal role in combating this epidemic. Our children need to understand the dangers of vaping, the potential harm it can cause to their bodies, and the long-term health implications. It's not about instilling fear, but about arming them with knowledge, the most powerful tool to make informed decisions about their health. The youth vaping epidemic is a ticking public health time bomb. The countdown has begun, and it's up to us to defuse it before it's too late. What can be done to curb the rising tide of vaping? This question has been resonating in the minds of health experts and policymakers worldwide. The answer lies in a multifaceted approach that combines stricter regulations, more severe penalties for non-compliance, and a concerted effort to raise public awareness. Experts like Dr. Salim Khan, head of the Department for Public Health at Birmingham City University, have been at the forefront of this cause. They argue that the evidence of growing vaping harms must be matched with decisive action. This involves introducing stringent measures against shops that illegally sell these devices to children, as well as increasing penalties for those caught selling vapes that don't meet UK regulatory standards. But it's not just about penalizing the culprits. It's also about amending the system that allows these issues to perpetuate. Dr. Khan emphasizes that the Department for Education should provide more guidance and support to schools to help curb the use of vapes on premises, highlighting the need for a systemic approach to this epidemic. Moreover, there's a pressing need for a broader education campaign on the dangers of vaping. There's a common misconception that vaping is a harmless alternative to smoking. This couldn't be further from the truth. Vaping delivers high doses of nicotine to the lungs, causing damage to lungs, airways, and blood vessels. In addition to these measures, Dr. Khan advocates for a vaping cessation strategy similar to the Stop Smoking campaign. This would involve providing appropriate support and counseling services for vape users, as well as making nicotine gum and patches freely available to help people gradually wean themselves off vapes. The fight against vaping is a battle that cannot be won overnight. It requires constant vigilance, stringent enforcement of regulations, and a commitment to educating the public about the dangers associated with vaping. The need for decisive action against vaping couldn't be more urgent. As the evidence continues to mount, it's clear that the time to act is now. What lies in the future for those who vape? This question weighs heavily on the minds of many, especially in light of recent studies linking vaping to a myriad of health complications. From headaches and flatulence to the more ominous heart failure, the hazards of vaping are beginning to surface, painting a grim picture of the potential long-term health consequences. The truth is, we're only beginning to grasp the full extent of vaping's aftermath. What's more troubling is the lack of a comprehensive vaping cessation strategy. Just as there are designated programs and resources to assist those wanting to quit smoking, a similar approach should be taken towards vaping. The absence of such a strategy may have inadvertently contributed to the rise in vaping, particularly among the youth and adults who've never smoked before. There's a pressing need for support services for those who wish to quit vaping. Counseling services, for instance, can play a crucial role in helping individuals navigate the challenges of withdrawal and the journey towards a vape-free life. Support groups, both online and offline, can also provide a sense of community and encouragement to those on the path to quitting. And then there's the question of alternatives. Safer alternatives like nicotine gum and patches have been proven effective in aiding smoking cessation. These alternatives deliver nicotine in a safer manner, helping to curb cravings without exposing the body to the harmful effects of vaping. While they may not be a magic bullet, they provide a viable option for those seeking to wean themselves off vapes. But these alternatives need to be made more accessible. This could mean making them available free of charge, or at least at a subsidized rate, especially for those who are financially disadvantaged. It's one thing to know that these alternatives exist, but another to be able to afford them. The future for vapers may be clouded with uncertainty, but with the right actions, a healthier path can be paved. As we continue to uncover the true impact of vaping, it's crucial that we also work towards creating an environment that supports those wanting to quit. For it's not just about highlighting the dangers of vaping, but also about providing a clear path away from it.